Number 19, using the iTero unit. That's for a full coverage crown. The very first scan that they're asking for is the occlusal view. So we want to just get the entire occlusal and try to get all the margins. Now they want the lingual view. So I'm going to turn this in like that and get about a 45-degree angle. You'll notice on the screen it doesn't look that clear. That's okay. It doesn't have to be clear on that screen. But it does have to be still. Okay, now they want 45 of the buckle. Yeah, I'm going to try to get the buckle margin, of course the entire buckle wall, but I don't want to tilt it all the way to the side like that. I want to come in at 45 degrees, just as they asked for. I'll hold it still. Now at that point, iTero says that it's finished. But I found that I like to get two more scans, one of the mesial and one of the distal. So I'm going to go over here, click Add Scans. And when I'm trying to get the distal of 19, I want to try to get as much as that distal wall of 19, but I don't want to block the margin from number 18. So you see, if I go like that, that's too far. That's going to be going too far the other direction. I want it just about there. That's going to capture the margin. Oh, it moved just a little bit. It's going to capture the distal margin as well as the distal wall of number 19. Okay, now we're going to take the mesial, capture the mesial wall. And again, I want to tilt it so that the premolar is just out of covering up that margin. And right there. And in some cases, if you need to better capture a margin, especially when it starts going a little bit subgingival, you can tilt it, like in this case, I'm going to try to capture that mesial margin and just place it just like that. And that would just be an additional view if you wanted. Or you can come in here on the lingual, try to get the lingual of the distal margin. Sometimes you can get a good shot just going right across the prep. Okay. I think we're ready to move on now. Again, iTero is just going to give you one shot for each contact, one for the distal, one for the mesial. I'm going to add more, but let's go ahead and take the distal as they're asking for. That's the distal buckle of 18. Here's the distal buckle of number 20. I'm going to go ahead and add additional scans. I'm going to now go to the mesial lingual of 18. Again, holding it still. You need it to be still for 4/10 of a second for it to capture. And then get the the distal lingual of number 20. Okay. And that looks good. Let's go ahead and move on. And from here on out, this is pretty easy. You're just going to get, again, a 45 degree. You're not going to tilt it completely over onto the buckle. Get it just like this. And make sure you get all of it, all of number 18. Don't cut off like the distal half, like that would be right there. Try to get all of it on there. So I'm going to get number 20. You notice I'm also getting number 21 in the shot as well, because iTero is only going to take me up to tooth number 21, but I want to get at least up to the canine. So now I can get 21 and 22 in the same shot. If you notice up here, there's something that did not stitch. We'll get to that in a second. Here's the occlusal. And although you don't need to spray any kind of dusting powder with that iTero unit, having it dry does make for a better result. And now I want to get 20, now if you notice that unstitched area that was up there, that now dropped into place. Now I'm going to get 21 as they're asking for, but I'm also going to make sure I get because I want the lab to be able to put together a good canine guidance with the dental model. Okay, now we're ready to do the occlusal. Do the opposing. So let's do tooth number 15. Not going to start with the occlusal. They want to start with the buccal. And you'll see we'll do this buccal series. There's 14. And again, I'm getting 13, but if you notice the position of 13, I have just a little bit of 14 that was on that picture, and I've got number 12 as well. So now when I move up to 12, I'll have enough room to capture number 11. Okay, now they want the occlusal view of 15. What iTero is going to do is going to take the buccal lingual segments and kind of treat it like a zipper. The most distal tooth that is the occlusal shot acts as the beginning of that zipper. They don't need palatal of 15. They already have that information. You just need to get the palatal of 14. Getting the gingival in these shots is not that important. It's the occlusal that's the most important. Okay, that segment is finished. All right, the next thing they're going to ask for is the bite. So there's the bite. I always have the patient tell them to bite down nice and firm, hold it still, make sure it's their normal bite. Make sure they're not positioning their jaw too far to the left, right, or forward. And now we're going to get, you don't necessarily have to get the prep tooth, get the unprepped teeth, something that's a good solid mark. And right there. There you go. Now we'll hit view. It'll take about 45 seconds to consolidate all those data points. Each picture constitutes 100,000 data points. All those data points are now created into this 3D image, and in just a moment we'll see our final result. Okay, so here's our final scan. And immediately it's going to show this, this occlusal clearance to kind of give us an idea. If we put the opposing arch on there, you'll see that those teeth are in contact. This tooth is in contact. That means we have a nice bite record. And it shows us that we have plenty of clearance. See a small amount of yellow, which on this screen means it's somewhere between 1.7 and 1.9 millimeters of clearance. You can remove that and just look at the stone model. If I remove the upper and look more closely here at the bottom, you can see there's a couple places where data is missing. Let me zoom in. You see right here, there's a piece of data missing. That's okay. That is actually more gingival or apical to the margin, and so having that information is not critical. Over on the contact of the molar, there's a couple areas that are spotty where the information is missing. The iTero people will fill that in with their software on their end. But it looks like we've captured the margin. It looks like all the necessary data that we need for the lab to make a crown has been captured. And so from this file, which we will now save, that information can be sent to iTero. They will then download it, mill out their model, and then that will be sent to the lab, upon which they can make any kind of regular restoration they would make on a stone model. It could be metal-based, it could be all porcelain, basically any removable, any fixed crown that you would normally work with can be done on one of these models. So we have found that in our practice working with this system, our fit on the prep tooth is more accurate than before, and the interproximal and occlusal contacts are better defined. So that's the iTero unit. Thanks.
And this time we'll have your bites together, like all the way, the normal bite, left teeth. This nice side, just kind of keep it nice and tight there.